Hi guys, welcome back to Tuesday Night Tips. My name is Dr. Dekhtyarev. I'm a physical therapist here at Back to Health Physical and Occupational Therapy. Thank you so much for always tuning in, watching what we're doing. And today is going to be one of those days where we're going to also show you something that we do here. Hopefully this will be helpful. I want to kind of take a little second and just say thank you to Rafael Mavi for setting this up for us last year, for starting this Tuesday Night Tips, because I believe we have showed so many new things and different things over the past year to the public, to the people, to our therapists, and maybe even other therapists out there. And I hope that this is helpful to you. It's definitely helpful to all of us as a team. Please leave your feedback, your comments, because we do read them, we do value all of that, and it helps us produce something new for you to watch. So thank you for always being with us and watching us and commenting. So today we're gonna kind of tune right in, and I'm gonna talk about a little bit what we're gonna show you today. Today I'm gonna show you, I'm gonna come stand up and I'm gonna have, actually I'm gonna take a little pause. I want to say thank you to the person that's always behind the screen and making this available for you. So thank you, Alessia. One day we'll get her in front of the screen. So anyway, so today we have this table. It's called the Flexion. If you can just get into here. This is a Flexion Distraction Table, and I've been wanting this table for a very long time. And basically what it does is it helps to decompress the spine. Some people call this the stretching table or the pulling table. This is usually by the patients. For the professional, this is a flexion distraction, meaning it opens up the spine, and it helps to move it forward and back, or extends and flexes. Well, basically opens up the discs and takes the pressure off your nerves. So I'll just show you a little bit how the table works, why is it called what it is, and then we're gonna actually put a patient on with our assistant, Jane. Thank you. And we'll show you how it's done, why and when do we use it. So the table turns on, we get to, so say the patient is laying on it, we get to open up the table where it extends and it distracts the body. This component of the table allows us to move the patient. So let's say if you have a pregnant patient, someone that's overweight and they have a belly and that's coming on the way, or someone that has a disc that's stuck and it's really compressing. So based on where and how it's compressing, we're able to move the body a little bit. And then the other component of this table is where we get to move the whole body with just an ease of a finger, without actually holding a human being and moving 100+ pounds. Here we're able to do this with just a little bit of a force. Okay? So we'll put the table together and we'll get a patient and we'll demonstrate. And as we will demonstrate, I will also kind of talk about a couple of different things, when and how it could be used. So Jane, if you don't mind, can you please lay down? You're going to lay down on your stomach. Good. You're going to rest your head right here. It has a hole so you can breathe. You're going to rest your arms right here. Excellent. And you're going to try to position where the space in the table goes by the low back, where we're going to be distracting her. Here, so we can get a nice good pull, where we would wrap up her feet, so this way again we have this nice firm feel, because it's going to be distracting through her legs or the lower extremities. Okay, are you comfortable?
Yes.
Excellent. So again, so now let's say if the patient is pregnant, or the patient is heavyweight, or again if they're not comfortable because they're having pain when the back is straight, I'm able to lift the patient up, and if you can look what's happening with the spine right here, she just curved out. So that already flexed the spine, taking some of the pressure off. On the other hand, let's say usually if you have a disc herniation, flexion would cause a lot more pain. So I would do vice versa. I would extend, and you can see how her spine dips down, which pushes the disc back into the space. right? So again, if you could see, there's like this curve, and with the table switch, now it looks more like a hump where it opens up the spine. So for the sake of for the tips, we're gonna put Jane into neutral, where her spine is nice and straight. So I'll start off. We're gonna ask Jane to stay comfortable, relax. Her feet are tied up, so we're gonna pull her spine out. Good. Then I get to open up the table, and sometimes you may need to readjust. Sorry, I'm all over the place. So this way her head is comfortable. Okay, so now this gives me mobility. I can move her whole lower body with just a little pressure. This is our spine. Right? So what we did by pulling it out, right, and this is the disc, we opened it up. Right? We opened it up, so let's say this, she's herniated right here, or this is impinging. We opened it up, and now we get to move the joint up and down, left and right. So the idea is we're gonna take the pressure of this nerve, because this herniation is pushing right here on this nerve, right here. So we're gonna open it up, and we're gonna try to move it up and down so it releases the pressure of this nerve. And when the pressure of this nerve is loose and it passes through, like on the other side, without anything pinching it, that symptoms that you have, something shooting down to your leg or your neck or your hand or your fingers, it gets loosened up, and now you're feeling ultimately no pain, no numbness, no tingling. Here, let's say after doing a detailed examination, let's say we focused and we found that her L4, L5 is tight. So I want to open L4 and L5. I would use my hand to stabilize L4 as I flex. So I'm holding L4 and I'm pulling the L5 down, opening up the space. And now let's say she has symptoms going down her left leg. Again, I would stabilize or hold L4, open L5 up, and now I would just basically open, right? Or vice versa, if I'm trying to push it back inside so it doesn't stick out, I would stabilize and I would push it back in. And I would do this in a nice, pain-free, symptom-free motion. This is something that I would always be talking to the patients to see, hey, how are you feeling? What I'm looking for is, with this procedure, is for the pain for never to shoot down lower. You want the pain to be increasing, but going more towards the spine, or hopefully decreasing, and the numbness going away. But if the pain increasing, but it's centralizing, that's always a positive sign, because you want the pain going from the leg up towards the back, and then hopefully that goes away afterwards. So again, some of the basic motion, you have flexion, you have extension, because now you can block and lift up. Right? You can go side, you can go the other side, and then if you need to, you can always do a nice motion one way or another way. And throughout the whole procedure, Jane, are you comfortable?
Yes, sir.
Excellent. Right, and you can always control depending on where you block. So let's say now L4, L5 has loosened up. I want to go up one, I can go to L3. Pulling the whole, anything below L3, opening it up. If I hold L2 and I pull it down, everything before that opens up, and I can pretty much do that so on. So, this is one cool piece of equipment to have here. Again, personally, I love this table. I think I can speak on behalf of all therapists. Like, if you're a manual therapist, this is an awesome table. You could do so much with it to make the patient comfortable, to ease their pain. Again, when would you do this? If someone has a sciatica, if someone has a herniation, if someone just has a lot of stiffness and the patient is a little bit bigger than you, the table assists you, because you saw how easily I was able to use lower, flex and extend her body just with a little bit of force. So again, hopefully this was helpful. If you have any questions about the table or what we do here, leave us comments, visit us at www.backtohealthnyc.com. Give us a call. I'm sure the phone number is going to be listed right below. Like us, follow us. We're here for you. So, see you soon.